Some men become concerned about their chest or breasts looking full, and it's despite being of normal weight or despite working out. This can be termed gynecomastia. It can potentially start at puberty or even occur later as a man ages. So how do we remove this area of fullness? Well, I think the best way to treat this area is to do liposuction. And the great thing about liposuction is there's really no visible scar associated with it, which is very important for a man who wants to be able to take his top off at the pool or at the beach and not have any visibility that they've had any sort of surgical procedure performed. So liposuction can be a great way to remove some of fullness on a man's breasts or chest without any sort of scarring. The best candidates for liposuction have tissue that is soft and feels fatty in nature versus, say, firm or hard, and they have fairly good overlying skin tone. So in those situations, we're able to remove that fatty tissue and some of the breast tissue, and the skin's going to retract and give the man a very nice natural contour. Sometimes, however, there can be an area of firmness, a localized area of dense breast tissue that may need a little bit more than liposuction. And in those situations, sometimes a small incision can be made around the areolar border, and we can actually remove any dense, firm breast tissue that is interfering with the overall breast contour or causing any puffiness of that nipple or areola. But typically, we try to avoid incisions on the male chest if possible. Now, liposuction, when we use it for the male chest, typically, because the male chest, the tissue is firm and dense and there's a component of breast tissue in there, we need to use a different type of technique, which can either be ultrasonic liposuction or even laser-assisted liposuction. And those techniques are important because they liquefy some of that tissue so it can be easily extracted. That's the best way to get a good result after liposuction of the male chest or gynecomastia. I'm Dr. Hayley Brown at Desert Hills Plastic Surgery Center. To learn more about gynecomastia, visit my website, www.deserthillsplasticsurgery.com.